Hey, I'd like to, first of all, thank you all for participating in the research study on the effects of body cooling on aging. You'll be asked to sign a disclaimer as you exit the building. So click. All right, my goals are up here, and as you read the goals I came up when Jean asked me to do the talk, I'm going to tell you kind of what my emotional goal with this is. And my emotional goal goes back a number of years. When I came here in '87, maybe about 2 or 3 years after I was here, everybody in Larimer County got really excited about maternity care and obstetrics. And we had a lot of community forums, one of which was, who's going to deliver our babies? And I really think we're coming around to that again as to who is going to care for our seniors. And because I'm a movie buff, I think a lot about movies like a wonderful movie called Network from a number of years ago. And I really want you guys to get mad as hell and not take it anymore as far as our health care for seniors. So that's my emotional goal for as we move forward here. So who provides health care for seniors? Not just in Larimer County, but all over. And most of it is provided by primary care physicians, general internists, family doctors, geriatricians, and nurse practitioners. That doesn't mean that specialists don't do care for seniors, particularly people like ophthalmologists, cardiologists, orthopedics, et cetera. That is oftentimes very dependent on insurance issues. I have a number of friends and patients in town who have TRICARE for Life, and if you have TRICARE for Life and want to go to a specific type of subspecialist, or I want to send you to a particular subspecialist, sometimes it's creative in terms of how we find who can take you. There's also issues of alternative practitioners, people like acupuncturists, massage therapists, and things like that, but that is almost never covered by health insurance. Sometimes it'll be covered by disability insurance or things like that. So that's who's taking care of the health care needs for seniors. Now, I'm going to start throwing some issues with you about the shortage of those people. So let's talk for a second about general internists. And if you live in Larimer County, or particularly in Fort Collins, you've seen in the last couple of years the decline, if not, it's not quite the death yet, but the decline of the general internist in primary care. There's a lot of reasons for that. Literally 2% of graduating medical care seniors plan to go into general internal medicine. It's not economically feasible for them to do that anymore. A lot of young people leave medical school with maybe $150,000 to $200,000 worth of loan repayments, and if they look at how much general internal medicine docs make versus how much an interventional radiologist makes, and look at how their family is expanded and do a little budget work, they say, I guess I really want to be I want to be an interventional radiologist after all. So there are some big issues in that. Family docs, of which I am one, take up about 12% of the physician workforce. And that's great, but we only provide a proportion of senior care because those docs who are doing full scope family medicine still take care of kids, moms, babies, things like that. So yes, we can get more family docs out there, hopefully, but that's not going to solve the problem. In addition, there is a significant decline in the number of U.S. graduating seniors going into family practice residencies. This is a graph, and I realize you can't see the details of the numbers, but I just want you to look at the curves are going down. The top curve is the number of positions that are offered nationwide by residency programs for family practitioners. So that has declined from 1997 to 2008. The bottom line is the number of those positions that are filled by U.S. seniors from medical school. And the difference between those slots are filled by foreign medical graduates who come over. And that is not to say that foreign medical graduates provide necessarily inferior care, but there are some differences in training that oftentimes create problems. So what about geriatricians? And periodically I'll get a call because I'm one of two certified geriatricians in practice in Fort Collins, and they'll say, gosh, Dr. Bermingham, is your practice open because I really want my mother or grandmother to have a geriatric physician. But if you look at the number of geriatricians out there, in 2007, 91 graduates from U.S. medical schools entered geriatric fellowships. That's nationwide. Most are destined for academic medicine. I'm associated with a residency program, so half my time I see patients, and the other half of the time I teach little Dr. Kildares, for those of you who remember Dr. Kildare. Or I guess these days I would be teaching JD for those of you who are into scrubs. So there's not a lot of certified geriatricians out there. And if you go into a geriatric fellowship, you're asking someone to do 1 or 2 years more of training to earn less than they would if they stayed in their primary specialty with our current reimbursement. So it's a little bit of a challenge. Obviously, then people aren't doing it, and from 2000 to 2007, the number of practicing geriatricians declined by 5.5%. So that is obviously not a solution. So how about nurse practitioners? And that's often offered as a solution. Now, I'll try to talk a little bit about solutions. I don't want this to be total doom and gloom on my part. But there's really very little data about what percent of nurse practitioners go into a practice that helps with seniors. I used to help teach some of the nurse practitioners that came out of the Greeley nurse practitioner program, and typically if I was talking to a nurse practitioner student, I would say, well, what do you want to do when you finish? Oh, I want to do moms and babies. Moms and babies are cute and cuddly, and it's the beginning of life, and a lot of NPs really get into that. There's not that as many going into senior care, and that may change. Nurse practitioners, I'm sorry, could you go back? I didn't realize I hadn't finished that. Nurse practitioners face the same reimbursement issues that we as docs do, and I suspect that's going to get worse as insurance companies start to realize that they're doing the same thing as docs do in many situations at a much lower malpractice cost, so I suspect their cost of doing business is going to go up in the next several years. As an example of that, there's a group called Medical Group Management Associates, and they look at and advise doctors' offices about what you need to do. And one particular person from MGMA that I spoke to said that he recommended when he was doing counseling for offices that people like NP groups or internal medicine groups or family practice groups to try to keep their percent of Medicare under 8% in their practice in order to make a profit. So when you think about the percent of seniors increasing, that's kind of frightening. So let's say that you can get in to see the doctor. Well, if you get in to see the doctor, great. So you get to have access. Are you going to have enough time to bring up the issues as a senior? Or if you're bringing in your mom, or are you going to have enough time to bring up the issues that you're concerned about? And the average primary care office visit time is shrinking substantially. I have a couple of very good friends here in town who recently changed to a concierge-style practice of medicine. Prior to doing that, one of them was telling me, well, our office window for patients now is down to 12 minutes per patient. So, if you're bringing in grandma who has diabetes, congestive heart failure, memory problems, how are you going to get all that in 12 minutes? It's kind of tough.